So welcome. This is Dennis Gadlin, Director of the Center for Healthcare Policy and Research at Penn State University. And today we do another installment of our Ask the Expert series, where we're going to be speaking on the topic of cancer and oncology care. And I'm pleased to have joining us today Dr. Ray Hohl, who is the Director of the Penn State Cancer Institute. Ray, thanks for coming. And
Thank you, Dennis. Happy to be here.
Great. So, I thought I'd start off with a real general question. As I mentioned, I was reading an article the other day, and the statistic just kind of jumped out at me again about how well we've done and the progress we've made on cancer care, particularly in terms of mortality, people not dying and living longer, and also living with less morbidity. And I guess I wanted to start out and say, as you've witnessed this over the past number of years, what do you attribute that success to?
Yeah, so I've been fortunate to have seen this for a long time and been in the field for 30 plus years. And during that period of time, we have made many, many strides, and we're really doing substantially better than we had. So, the number of deaths that go along with having been diagnosed with cancer are going down. The quality of life in terms of how people do is substantially improved for long periods of time. The challenge is that a lot of that continues to be related to improvements in picking up cancers earlier. So earlier detection and screening, a little bit of headroads into prevention. So, for example, the biggest prevention effort that's been out there that's very effective is the human papillomavirus vaccine for a number of cancers, including cervical cancer, but also head and neck cancers. I think anyone that follows the Hollywood types, recognizes Michael Douglas had head and neck cancer from HPV, the papillomavirus, and so it's really getting awareness out so people can do things like take preventive steps to try to prevent the cancer from ever occurring, do screenings as appropriate, whether it's mammography or colonoscopy or what have you, to detect the cancers earlier. And because the best way to treat a cancer is either prevent it, and we've made modest, some strides in that over the years, but really picking them up earlier. So what we have to do to kind of have people carry on with their lives after that diagnosis is, the cancer itself doesn't affect it as much as it used to.